During the worst of it, Holy Name Medical Center in Teaneck had about 250 COVID-19 patients. 4 staff members even died from it.
A moment of silence, a moment of grief, and then everybody had to return back to where they were because there was no time to stop and think.
Michelle Aceto is the director of nursing operations. She says the hospital was so inundated, it added more than 100 beds and constructed 5 more ICUs. Today
we're down to 9 patients.
And new COVID patient admissions are down to about 1 to 2 per week.
Where at the height of the pandemic, we were having 1 or 2 every 15 to 20 minutes.
As you can hear, it's relatively quiet out here. They say that is another noticeable difference.
We heard the ambulances coming. At the height of things, there were overhead announcements, almost constant emergency response.
The worst of the crisis behind them, the hospital is now set to resume elective surgeries.
Orthopedic cases, we're going to see general surgery, some gallbladder surgeries, things of that nature, until we ramp up to full speed.
Patients will be tested for COVID-19 72 hours before the surgery, and the no visitor policy remains in place. The entire institution was cleaned using a 5-step process that involves UV lights and electrostatic disinfectant sprayers. So what becomes of all the new construction and other equipment used during the pandemic? ICUs in areas like a conference room will remain, and so will the additional 270 negative pressure beds. That keeps contaminated air where a patient is from escaping, filtering it outside through a HEPA filter.
In the event that there is a second wave, or if this occurs at another time.
So now the goal is to get the message out to those who need surgery.
The last thing we want to see is the person who's waiting, and then they've waited so long that their illness is beyond repair, or they've become sicker because of it.
They say they're more prepared than ever before. In Teaneck, New Jersey, Alice Gaynor, CBS 2 News.